Back on the show. Bo is my co-host, and
Hello, everyone.
she's bringing all her friends on the show today, including Vivian Kulaga, who is our next guest, who's on right now. Hi, Vivian.
Hi, Hugh. Hi,
Right?
everyone.
And you're a doctor, but we
I-
shouldn't call you doctor.
Yeah, I have a PhD. You can call me doctor in an academic setting.
Okay, great.
Yeah.
And so, what did you get your PhD in?
It's actually in medical science, from the Institute of Medical Science at U of T.
That sounds like almost being like a real doctor.
Yeah,
It actually does,
medical,
yeah. It's kind of confusing. I could potentially teach in the Faculty of Medicine.
Oh, yeah?
But I'm not, I don't practice medicine. And it's a bit different, yeah.
So, what do you practice then?
Well, actually, my career took a turn into mental health.
Yeah.
And so what I do is I help people recover from complex illness, chronic pain, and psychological trauma. In particular, psychological trauma, a lot of PTSD, post-traumatic stress disorder, and that kind of thing.
And so, what happened? What was it that caused this turn in your career?
Well, yeah, it was actually a personal journey. About a decade ago, I got really ill. I was traveling, I was on my backpacking trip around the world, and due to exposure to rare parasite and toxic exposure of pesticides, because they were fumigating for malaria, I ended up contracting or developing a couple of very serious chronic forms of illness and disease. And so I became disabled and debilitated for some time. And it was a bit of a journey, for recovery, the years of recovery and investigating different strategies and so forth. And in that time, I also had a lot of quiet space to kind of think about what I want to do with my life, if I could do anything with my life. And I realized that I actually wanted to help people, and that started to kind of focus in over the time. And so basically what I've done now is made a career of that, and helping to, because I've recovered from a lot of things that some people don't recover easily from. And so I help teach people that. I do that on my YouTube channel, and I also have a podcast that I do where I interview scientists and ask really cool questions about, like the physiology of thoughts and emotions and things like that, and just very much about the mind and body connection.
So, did you come up with some unique strategies when you were dealing with your own personal health crisis?
Yeah, I did. It's hard to, I guess, it's not, I did several kinds of therapies, right? So initially it was important to get a lot of medical care and, develop a clean and healthy lifestyle, the standards of good food, clean water, exercise, sleep, all that. But in addition to that, in terms of my mental health, I didn't realize what an important role that plays in general well-being, and what a connection that can have in terms of your physical well-being. And so, I did EMDR therapy, which I'm also a practitioner
What
of.
is that?
It stands for eye movement desensitization reprocessing therapy. I actually have a video that explains it perfectly on my YouTube channel, but I'll explain it to you because if you want. So it's actually a psychotherapeutic technique, and it's gotten a lot of really good, publicity, because it's highly effective, and it's also been studied a lot. There's over 100 scientific papers on it, over 30 positive control trials proving its efficacy. And it's mostly used for post-traumatic stress disorder, so treating psychological trauma. But the thing is, it's got a lot of other applications like depression or feeling stuck in your life, low self-esteem, codependent relationships, things like that, because a lot of the roots of those kinds of issues are often, they can often lead back to psychological trauma. And not everyone necessarily knows what psychological trauma is. It sounds kind of maybe fancy, but really it could be something like being bullied in school, which a lot of people can relate to, or having an abusive parent, or someone's sudden death, witnessing a traumatic event, anything that really puts you in that state of fight or flight, fear, can really, is a form of psychological trauma, which impacts the brain.
So this EMDR can help with any of those issues, right? But so how does it work? Like the eye movement is kind
I'm
of...
so glad you asked that. I actually interviewed already about 5 neuroscientists on my podcast. They're not all published yet, but and I asked them that because I read the books, I read the scientific papers, and then I asked one of the leading scientists that's based in Europe, how does this really work, right? Because he's going to tell me better than all that literature. And so, basically, the eye movements, it's called eye movement desensitization reprocessing therapy because it involves a series of eye movements. So moving your eyes from one side to the other, but this can also be used doing tapping because the important part is that you're stimulating the brain from one side to the other, right? And what that induces, it does a lot of things, but one of the things it does is it changes the brain frequency. And the brain frequency becomes slower and it actually mimics slow wave sleep. So not necessarily REM where you have the rapid eye movements, but slow wave sleep, which is a type of sleep.
Is that theta?
It's actually delta. It's actually delta, yeah. And so that, and I'm quoting Marco Pagani, I hope I got his name right, but we discussed this in the podcast interview, and basically, the induction of that brainwave state turns the brain on to start integrating stuff in a way that you do when you naturally sleep. But here's a really key thing, is when you have psychological trauma, and PTSD is a good example, so like you have these triggers where it's like you walk into a room and all of a sudden like something happens, you don't quite know what, but you're really scared, or you freak out, or you have a panic attack. And that's because what's being fired are called implicit triggers. Like it's a body memory of an event that happened, that happened when you were traumatized, but you don't necessarily have a clear memory of it, because when you're in a traumatic event or episode, the chemicals, the hormones that are fired in your brain actually turn off the higher thinking centers, so you can't make sense of it and you can't always remember it clearly. But here's where EMDR comes in. We bring you back into that memory, and maybe it's just remembering the body sensation and it's fragmented, right? And then when we help to induce this brainwave state. We turn on the brain's capacity to integrate that information in a healthy, adaptive way. And it's really remarkable because what happens is patients release the trauma, the emotions associated with that, so they don't have those same triggers and flashbacks. And also they change the negative beliefs automatically change that were formed around the time of the event. So for example, if you were abused, right, a lot of abuse victims tend to internalize like I'm bad or I'm worthless and things like that. So when you process those kinds of traumas, basically those beliefs get reversed. So you actually, it's not just someone telling you, okay, I know I'm worthwhile. And you're like, yeah, okay, I know I'm worthwhile, but inside I feel crappy. It's like you actually feel like, whoa, I actually am a valuable human being, And so those shifts happen, and that's really, it's not like a cognitive therapy where you're talking about it. It's more like a subconscious almost therapy. Like you're aware of it, but the neural connections in the brain are changed. And so after the session, you just feel differently.
So it sounds like that can really make rapid progress, whereas sometimes this talk therapy can go on for years and years and years and nothing happens.
Exactly. I'm not going to say nothing happens, but it's slow progress.
Like the Bob Newhart show.
Maybe. But you're right, and it is a rapid form of therapy, and that's what I love, because if you know me, I'm all about efficiency.
Yeah, right.
So is it more like your physical body, the physiological changes that happen during that state? The body gets used to that when it's triggered.
What do you mean?
It adapts to the triggers.
No, it doesn't adapt to them.
But it adapts to get you out of it. When you get out of it, it helps you to kind of
No, it changes the connections. It breaks that previous association
Right.
that caused the trigger. So
But it puts
it's
you into a relaxation state, the
yeah, you do.
EMDR.
Yeah, it does put you into a
uh,
relaxation state. So what it teaches you is like a lot of people who have panic attacks may have had an event where they thought they were going to die, for example, right? Like a bank robbery or something like that, held to their head, or drowning, near drowning, things like that. And so, when they're in a similar situation, maybe like water or something, or a bank, they subconsciously, they don't think this consciously, but they actually feel like they're going to die. So when you go in and you process that with EMDR, the brain learns, I didn't die, I'm safe now. So it actually changes the whole relationship to the associations, to the triggers, so that you no longer feel that way. So it's just like then you feel safe in water, or you feel safe
Right,
in
and then your body also then physiologically
Yes, yeah.
changes
Yes, yeah.
to adapt to that state.
Yeah, well, because
positive way.
you're no longer triggered,
Yes,
so
yeah.
then your body stays relaxed. Yeah.
So do you need to know what the issue is? Or, because most people probably, even if they can't put their finger on it, have been traumatized in
Yes,
some form or
that's
another
true.
at some point.
Yeah.
Because everybody's operating at a little less than 100% perfectness, right? Probably because of that. Like, can you do this therapy and then, not have to deal with those little things anymore?
Yeah, because what you're talking about is sort of like global shifts, right? Like in the sense that
Yeah.
you perhaps work on one thing, but it changes your whole internal paradigm. So basically, all those little problems, they're just different threads sometimes of the same problem. Like,
Because everybody's stuck in patterns.
yeah,
Right?
Yeah.
Whatever it is. So maybe they don't have enough money, or maybe they always, maybe they just can't get a partner in life, or maybe they just, whatever it is, right? They're always experiencing the same kind of hang-ups, the patterns, yeah.
So yeah, a good example is if one of their root issues is that they don't feel that they're good enough, that can affect their relationships, that can affect their ability to assert themselves and to navigate properly at work. It can affect so many different things. So, and maybe that's just due to one type of trauma, or a series of traumas, like for example, an abusive parent, right, or bullying at school. And so when you resolve that trauma, you change the internal paradigm, you change the way the person feels about themselves, what they believe about themselves, and what they believe about the world. So everything changes. So their relationships change. They feel more valuable, that they can get that partner that they want because they deserve it. They can get that job that they want because they deserve it. They can assert themselves because they deserve it. So does that answer your question?
Kind of. Could we do it right now and be free of all our little problems?
Yeah, well, it takes a little bit of time. So we did talk about how it's rapid,
Yeah.
but I'll tell you, so some people are like, oh, can you do this in 1 or 2 or 3 sessions? Because there's a lot
Yeah,
of...
how many sessions does it take?
Yeah, I know, that's a good question. So there's research to show these miraculous results after 1, 2, 3 sessions. But that is usually what we call like single trauma events, where it's like, you were witness to something horrible, or God forbid you were assaulted or violated or something like that. And in those cases, not in all cases, but in particular cases, you can have that rapid change in 1 or 2 or 3 sessions. But when it gets more complicated is when you have like what we call a sort of ongoing traumas, or they're called small t traumas, like big T trauma and small t trauma. But it's not that the small t traumas are less significant, because let's say you were abused violently for a number of years, they would still be called small t traumas. It's just because there's several of them. So basically, the more like things that you have,
The longer it's going to
the
take.
longer it's going to take, right? You're not going to just do 1 or 2, 3 sessions. And so then we get into complex trauma, right? But the point is that it's not the same as other forms of therapy that can take, years. You were talking usually weeks to months. In very rare cases, it can take longer, depending on if there's, multiple mental health diagnoses. But yeah,
Well, that's fascinating.
thanks.
I've never heard of that one before.
Okay, really?
So yeah, so that's
Oh. So that's really good for you to know, because it's good to have that handy, and if you meet someone that really needs it. Mm-hmm. Because one thing that really is unfortunate is I get a lot of clients that have been to other therapy. The one actually had therapy for almost 50 years. That was the longest. But most of them have had therapy for 5 or 6 years and been to different places. And then they're like, oh, I wish I knew about EMDR sooner, you know, which is why I've done a lot of promotional stuff and videos and stuff for EMDR. It's not just for my practice, because my practice is actually full, but it's because it's just such a wonderful therapy, you know, that I really feel like everyone should know about it, because many people can benefit.
So are there, Bo, you have a question.
Oh,
You go.
sorry.
Yeah.
I was just going to ask you if you experienced this to get out of your, when you were ill, when you had, when you
Yeah,
said you
because
went through the
physical
disability and
illness
stuff.
can, as well,
Yeah.
you kind of already alluded to it, but it
Yeah.
can be tied to a
Yeah.
mental, emotional condition.
Yeah, so yeah, it's really complicated. In my case, I did use it. So my illness was so devastating that I was in a really dark place, and I went to see a psychologist because I was just like, I know I need help. Like, it wasn't for my illness, it was just, I need some emotional support, right? But that psychologist said, you need EMDR therapy. And at the time, I was actually living in South America, and I was, like, my health had completely collapsed, and I was no longer able to work or live, and I was basically ready to die. And, but then, because I'm a scientist, I did some research in the peer-reviewed literature, and I found exactly a description of the things that I was going through, and I contacted the scientist that wrote the article. And long story short, he put me in touch with a medical clinic in the United States. So the point is that I was packing up my life in South America, and I was going to some clinic in the United States. And so he said to me, he can't do the EMDR because he didn't want to start it and then have it interrupted. So that interrupted it. And then I had, you know, medical help and whatever, and then I came back to Canada, and that's when I started the EMDR therapy, you know. And originally it was just for the trauma of, like, oh my God, I have this illness, and it's devastated my life. You know, I did a PhD, and now I'm on disability. Like, where is this going to go? You know, and it was very devastating. And, you know, I can talk about it like this now because I've done EMDR. It used to make me really cry to even talk about it. But yeah, and then just getting back to the physical aspect. So, you know, the medical therapies and such that I did really helped me recover a lot, but it was like maybe 70%. And then there was a significant amount that I still had a lot of trouble to try to do daily life. And so I did EMDR and I did hypnosis, and more recently I did dynamic neural retraining system, which is another therapy that retrains the brain, rewires the brain. And really the combination for me was really crucial in getting over all the rest of the physical issues. And I've also done Vipassana. Have you heard of Vipassana?
Yes, I have, yeah.
Meditation is absolutely phenomenal. I highly recommend it, which is why I also teach it in my YouTube. But so the Vipassana also, you know, it's a silent meditation for 10 days, and it really taught me, like, so when I had fibromyalgia, it taught me the connection between, like, how much of this was mental suffering and how much was physical suffering. Because after 3 days of excruciating physical pain, and when I was sitting for 12 hours a day, and I felt like they had, like, hammers just smashing my joints, and you know, eventually you get to this point, because the teacher keeps saying, equanimous, you don't care, you know? And eventually you get to this point where, okay, I'm equanimous, I'm settled, I don't care. And then boom, like 70% of the pain lifted. It was just gone. And it was like, there was some physical pain, but it was very minor. And I was like, wow, just look at the difference between how much of that pain was actually created by the suffering. My emotions about the pain were creating physical pain. You know, and that was a real learning lesson for me on terms of the mind and the body, and like how the mind, the emotions that you have, can produce a lot of physical symptoms, and especially pain.
Psychosomatic illness.
Yeah, I don't like that term.
No, you don't
I don't
like
like
that
that
term.
term because it makes people feel, it's kind of like this label of like, oh, there's something in your head and you're making
Right.
it up.
Yeah.
And that's not the case. It's like, you know, when you see something scary and your heart races. It's like what your fear is connected to
But
your
it's
physiology.
normal, that's normal,
Right?
yeah.
Your emotions are connected to your physiology. If you are stressed out, I mean, everybody knows that stress can be a killer. If you're stressed out for years, you have higher risk of cardiovascular disease, right? It's not well, is it psychosomatic? We could say it. Cardiovascular disease is a psychosomatic illness, right? Like, I don't know.
Okay, I got a question for you.
Sure.
We don't have a lot of time
Yeah,
left,
yeah, yeah.
but this is amazing. But I want to ask you because, if you follow all this conspiracy stuff, you hear about this MKUltra mind control stuff. You know about that?
No, I
Okay,
haven't.
but okay,
I
then
don't
I'll
follow
just-
conspiracy
All
stuff.
right. Well, but it's also related to what do they call multiple personality disorder, or
Okay.
there's other name for that. now.
Dissociated,
Di-
identity disorder, yeah.
So would this EMDR therapy be good for that, or do you have any
For DID?
experience? Yeah.
Yes, I know that I don't specialize in that, so I
Yeah.
don't. But I do know therapists that do specialize in that, and there is specialized training with EMDR for that, and I've heard very good things about that.
Okay.
Yeah.
Great. Now, is this the only therapy that you practice?
It's so yes and no, in the sense that I'm trained in other things like hypnotherapy and a lot of mindfulness-based strategies, but I like to tell people like EMDR is like the big guns. It's like you've got a real problem.
This works. It's
I really want to fix it.
like a proven
It's
method.
proven, and
Yeah.
I'm a scientist, so originally, like, I very much go towards where the science is, and like I love doing hypnosis too because it's so much fun and it really is effective. And I didn't know, but there actually is quite a bit of science behind hypnosis. But if you really need something just changed and shifted, like a permanent shift, like then EMDR, like that's my approach because I just want the person to shift,
Right.
But I do sometimes incorporate the other things, right? Like, for example, starting a meditation practice and things like that. It's not necessary, but it's so beneficial because I'm interested in total wellness.
Right. So you can look at the patient and kind of customize based on everything you know of
Yeah,
the program
exactly.
for them.
Yeah, yeah.
So I know your practice is full, as you said. So what can we tell people
Okay.
about what they can do? I know you got a YouTube channel. You
Yeah,
drink coffee with
yeah.
scientists, I understand sometimes.
Yeah, so there's my YouTube channel and Coffee with Science. So even though my practice is full, I do have a waiting list, and spots become available and stuff. So it's not like never, but yes, that's why I have a YouTube channel because I try to do tips and stuff off of there. To help people, and I also have another website which you can link off from my main website, which is self-EMDR.org, where I teach people how to do the therapy themselves,
Oh,
the
that's
EMDR
good.
themselves. Yeah.
Self-EMDR.org.
Self-EM.org, yeah.
That sounds good.
And so it's been in person, but now and therefore that was a little bit expensive. But now I'm going to actually put it online soon, hopefully, and so then it'll make it more economical for people, and they can do it themselves. And then there's the group retreats possibility, but then there's also just doing it yourself. And there's going to be more tools that go on there. I'm developing stuff, but it just takes time. And like I said, so they can do that. Then the Coffee with Scientists is the podcast if they want to listen to the science behind some of these things and just other really cool things. Just like when I hear something really cool and I'm like, oh, I want to interview that person. And it's all just health and wellness stuff, with a bit of a focus on mental health because obviously that's my keen area of interest and neuroscience. My undergrad is in neuroscience, so
Okay.
yeah.
Well, this has been great.
Thank you.
Learn something new every day here on
Yeah,
Liquid Lunch. I'm going to go check out that website, selfemdr.org. I want to, whatever that is.
Thank you.
So thanks for doing this.
Thank you. I really appreciate that.
Okay.
Thanks for having me.
Thanks. And thanks, Bo, for bringing her in.
You're welcome.
Yeah. Thank
Did you know all that stuff about her before now?
No, not at all, actually. I just recently met her 2 weeks ago.
Oh.
Yeah, at our Speaker Slam practice group, because we were in the same group which does practicing inspirational speaking.
Yeah.
Okay. Well, great.
Wonderful.
All right.
Yeah.
Okay. Well, thanks for coming in.
Thank you.
Okay, we're going to take a break. We got more coming up. LiquidLunch@ThatChannel.com.
Good. We're done. All right. That was fun.
Yeah, that was fun.